A test that we're going to do to determine the organisms that you grew from behind your ear is the API Staph test. What this is 20 biochemical tests in a strip, which I'll show you in a second, that you can use to develop a number to compare it to a known chart to determine what organism you have. And so to do this, the first thing you're going to do is get your humidity chamber. This is 2 parts that kind of open and close, and you're going to humidify them. So what you'll do is you'll take your DI water and you're just going to squirt a little bit into there like this, and then kind of tap off the excess. You want quite a bit of humidity so that the wells don't dry out while they're incubating. The next thing that you'll do is open your API Staph strip and show you what that looks like. So it's a strip like this with little micro wells throughout, and what we're going to do is make a suspension with our bacteria, and we're going to fill all of these strips and then we'll incubate them. So I'll go ahead and just place it right on in here for now and get my flame started so I can make my suspension. Now to do this, it comes with a Staph medium, and you will have these, and the first thing you have to do, which is kind of awkward, is just break the top off. So what you do is you put your thumb here and you just hear it click, and then you can just gently take the top off and you break it. This just ensures that it stays sterile. Then you're going to pour this into an empty tube. So you'll flame it. Carefully pour it in. Now this is sterile, so it can go to glass trash. So just put your top on and set it aside, and we'll pick it up later. So once you have your medium in there, you're going to make a slight turbid suspension. So you'll take your swab and pick up about 3 to 4 colonies, depending on the size of your colonies. You can always add more if you need to make it more turbid. And then you'll just swirl it around to make sure you get all the bacteria off. So now that it's slightly turbid, you're going to inoculate each of the wells using a transfer pipette. Stop for a second. Okay, so now you have your suspension. You're going to use a transfer pipette to fill each of the wells. As you fill them, it's really important that you want to drop it down the side so that you don't get a bubble in it. And so you kind of take your time, get some of your suspension, and then as you come in, you just want to drop it down the side just to fill it up to where the top of the tubule starts. That, and then you go to the next one. So you see, you want to do it from the edge as it fills up. You don't want to do it straight down the middle because you increase your chances of getting a bubble. Now when you get to the ADH and URE, which are the last 2 tubules, you want to leave a little bit of room at the top because you're going to add mineral oil. The reason you add mineral oil is to create an anaerobic environment to cut off the oxygen from the top. This is important for just these 2 tests and no other tests. So the next thing we're gonna do is come to my ADH and URE, and I'm gonna take some mineral oil and just put a couple drops on the top of it so that I'm sealing it from the air using the oil. So for one of my tubules, I have a little bubble, so I'm gonna show you how to do this to fix the problem in case you get any. You're gonna get a new transfer pipette, and then what you'll do is just take the pipette and try to suck up some of the suspension in there and see if you can get the bubble. If you can't, it's okay, but sometimes it helps to try to get it out this way. Once you have filled all your tubules and placed your mineral oil, all you're going to do is take your humidity chamber and close it up, and then just put a little piece of tape at the top so that it'll stay closed. And just be gentle with it as you go so that you don't spill anything out of the tubes. Just put a little piece of tape, and then you're going to want to label this for you to be incubated. And then you want to try to keep it standing up, and then when we put them in the basket, we'll incubate them standing this way. Then you're all set.